Welcome back, ladies and gentlemen, to Therma channel, transforming innovation into wellness. Joining us is the Chief Executive Officer, Rob Fia. Welcome back, sir.
Thank you, Kyle. Nice to see you.
Always a pleasure to have you back, man. We got lots to dive into today. You guys have been releasing a lot of news over the last month. First and foremost, Thermabright's AcuVid U.S. clinical performance study successfully exceeds U.S. Food and Drug Administration emergency use authorization requirements. What does that mean for Thermabright? Break that down for us.
Basically, it means that we've met their criteria. The minimum sensitivity rate is 80%. So we've exceeded that. I think we hit 80.3%. And the specificity was up around 98%. And those are the requirements the FDA is looking for if you're going to submit an FDA EUA submission. So we've met those criteria.
Do you want to break down AcuVid real briefly for newer viewers?
Yeah, AcuVid is a very simple saliva-based antigen test that tests for COVID-19. It works like a pregnancy test. There's a cartridge. You would use the sample of saliva, mix it with buffer, and you would put 3 or 4 drops onto that cartridge. And within 15 minutes, you get your results as to whether you're positive or negative.
Appreciate that. So recently, you also received a patent for a device for applying topical treatment from U.S. Patent and Trademark Office. What does that mean for you guys?
Well, this is huge for us. That relates to 2 products of ours. One is the Intercept CS, which we have a prevention claim from Health Canada, prevention against cold sores. And it's also applies to our TheraZap product, which is used for insect bites, for relief of pain and itch from insect bites. So what we've done is we've incorporated a number of sophisticated technologies. We're using certain metals, antimicrobial metals, such as copper and silver, and then we're using specialized coatings and applying heat, etc., to the skin that actually prevents the cold sore. If you're talking about the Intercept CS and or relieves pain and itch from insect bites. But what we also did with TheraZap is we tested that product against Zika in a study that we did with University Health Network here in Ontario, and it showed effectiveness to basically kill off the Zika virus. So we'll continue on with testing with that product in the future.
Great to hear, man. You guys are moving on many different fronts here. And just to put a cherry on top of that cake, you just closed a $6 million in Canadian private placement financing there. Do you want, and this is from institutional investors as well. First and foremost, I guess, what are we going to be using that cash for? And what are you doing to attract those institutional investors?
Yeah, I mean, that's a great company we're working with, H.C. Wainwright out of the U.S. They approached us. There's a great group. They wanted to do a financing several times with us, and I was pushing it off, obviously waiting for FDA EUA submission. And I thought, the timing was right to do this because we do need working capital, and that's mainly what the capital will be used for, and for the expansion and to look at growth opportunities as well.
On that note, Rob, I appreciate these insights today. Thanks so much for coming out.
Thanks, Cal. Nice seeing you.
Always a pleasure. On that note, folks, I pass the question off to you. Let us know what you think in that comment section below, as always, and consider subscribing, because as this news comes down the wire, we'll continue to update you here. But stay cool, stay awesome, and as always, I look forward to catching you in the next one.